Thank you very much, Alicia. Good morning. I'm Dr. Bruce Vanderhoff, the Chief Medical Officer of the Ohio Department of Health. And as we discussed last week, after a period of steady decline, we continue to see a pattern of COVID-19 cases rising again in Ohio. The statewide average of cases per 100,000 residents over 2 weeks is now 45.8, as last reported Thursday, July 22nd. This is an increase from the 2-week average of 27 cases per 100,000 reported July 15th, and a significant increase from our low of 17.6 as of July 7th. All signs point to this increase in cases being a result of the Delta variant, which is even more contagious than the B.1.1.7 or Alpha variant that preceded it, and which itself was more contagious than the virus that caused our winter surge. It simply takes less of this virus to spread from the mouth or nose of an infected person to that of another non-infected person. Fortunately, our vaccines continue to provide strong protection even against this new variant. As a result, COVID-19 remains a threat primarily for unvaccinated Ohioans. As a result, those who aren't yet vaccinated are encouraged to wear a mask in indoor spaces and outdoors in crowded spaces and when social distancing simply isn't possible. If you aren't yet sure about getting the COVID-19 vaccine, we ask you to talk to your doctor or other trusted healthcare provider about the safety of COVID-19 vaccines and side effects, which are mostly mild and short in duration. COVID-19 vaccines simply offer the best protection against COVID-19, followed by masks with layered safety measures like social distancing. Recently, both the CDC and the American Academy of Pediatrics have shared recommendations for the coming school year. We've closely reviewed these recommendations and sought input from a wide variety of experts. And the Ohio Department of Health will be releasing updated guidance for schools as they plan for the new academic year. And this guidance will be posted no later than tomorrow. While there are no mandates associated with this guidance, we believe that the recommendations we are issuing are essential to the health of Ohio's youth and the success of the coming school year. The safety of Ohio's children is paramount, and the preventive measures that schools take will help protect Ohio students. Now, while children are less likely than adults to get severely ill from COVID-19, they're not invincible, and most certainly can and do have the risk of becoming ill. Just like adults, children get sick from COVID-19. They spread it to others, and some suffer severe health outcomes. Sadly, hundreds of Ohio's children have suffered a very severe illness associated with COVID-19, the multisystem inflammatory syndrome, landing them in hospitals and intensive care units with severe inflammation of various organs and blood vessels. This is a bad virus, even for our children. Nevertheless, we know that in-person learning is very important for the cognitive, social, and emotional development of our children and can be conducted safely even in the face of COVID-19. We know that many students learn best in person. In addition to academics, schools also play a critical role in encouraging healthy eating and allowing children to get regular physical activity. Of course, being in person with teachers and other students is also an important factor for the emotional health of many students. Issuing this guidance will allow school districts to have the flexibility and support they need to provide access to in-person learning 5 days a week. As students prepare to head back to school, we are building upon the layered prevention strategies that were remarkably effective at controlling COVID-19 last school year. along with the addition of encouraging COVID vaccines that are now available and authorized for those who are 12 or older. And of course, that began this May. Our guidance focuses on 3 layers of protection. First, we strongly recommend vaccinations for staff and eligible students. Secondly, we strongly recommend those who are unvaccinated consistently wear masks, which have proven a very effective tool for reducing the spread of the virus. And third, additional measures, including improving ventilation, maximizing distance between people, good hand sanitation, and others. Last year, consistent implementation of core prevention measures helped limit the spread of COVID-19 in the classroom. Continuing to follow these recommendations will help protect students as we approach the fall. First, I want to talk about vaccinations. We encourage COVID-19 vaccines for staff and eligible students. Vaccination is simply the leading public health prevention strategy to end the COVID-19 pandemic. Achieving high levels of COVID-19 vaccination among eligible students, as well as teachers, staff, and household members, is one of the most critical strategies to help schools safely conduct in-person learning and allow safe participation in extracurricular activities and sports. People who are fully vaccinated against COVID-19 are at low risk of symptomatic or severe infection. Adults working in schools have been eligible to be vaccinated since February. Today, more than 5.3 million Ohioans and 162 million people in the United States are fully vaccinated. All the normal safety steps were taken in developing these vaccines, including clinical trials that started in the early days of the pandemic, all the way back in March of 2020. Yet we know many Ohioans and others across the country remain hesitant to be vaccinated. This includes some parents thinking about whether they should choose to protect their children with COVID-19 vaccines. My best recommendation for those who remain concerned is to talk to their doctor, nurse, or pharmacist about the COVID-19 vaccines. If you have questions, please get the facts from a trusted healthcare provider so you can make the safest decision for you and your family. Many of the questions I hear focus on the risks of the COVID-19 vaccine, which for most children at this time is the Pfizer vaccine. Not everyone experiences side effects from COVID-19 vaccines, but even for those who do, the most common ones reported include pain, redness, or swelling at the injection site. And throughout your body, you could experience tiredness, headache, muscle pain, chills, fever, nausea. These side effects are a part of the body's natural immune response and are far, far less severe than the damage or symptoms that COVID-19 itself could cause. The other risks parents worry about include myocarditis. Fortunately, this risk is rare, something most people recover from on their own, and is much more likely after an actual COVID-19 illness. Simply said, the risks of COVID-19 are far worse than any risks from the vaccine, and we encourage anyone with concerns about the vaccine to talk to their doctor to get the facts. I also want to remind parents and guardians that it can take 5 to 6 weeks to be fully vaccinated. For youth who are eligible for the Pfizer vaccine, it takes 5 weeks. The first dose, followed by their second dose 3 weeks later, and then full protection 2 weeks after that. I know it can be difficult to schedule a vaccine appointment between summer activities, including vacations. Bear in mind that COVID-19 can be administered along with other back-to-school immunizations, and along with those vaccines, plays a really important role in keeping children safe. Next, I'd like to talk about masking in schools. Wearing masks protect students, teachers, and staff from COVID-19. This is especially important indoors in crowded settings where physical distancing can't be maintained or for individuals who aren't fully vaccinated. We therefore encourage consistent and correct mask use in the schools for anyone who is unvaccinated, which includes wearing masks indoors at school. Now, generally, mask use isn't necessary when outdoors, including when participating in outdoor play, recess, and physical education activities. Our mask recommendation is based in science, but it's not a mandate. For those districts that do not follow our recommendation to mask for the unvaccinated, remember that parents can still choose to have their children wear a mask in school or while participating in school activities. Next, I want to address distancing in schools. We recommend 3 to 6 feet of distance between students whenever possible. When it's not possible to maintain a physical distance of at least 3 feet, it is especially important that schools layer multiple other prevention strategies, including indoor masking, good ventilation, regular cleaning, hand washing, covering coughs and sneezes, and staying home when sick. Finally, I want to address ventilation and other preventive measures in schools. Schools should make every effort to provide good ventilation within classrooms and other common spaces. One way to achieve proper ventilation is to bring in as much outdoor air as possible. When safe, schools should open windows and doors and use child-safe fans. Similarly, windows on buses and school vehicles should be kept open when safe. Proper maintenance and use of HVAC systems is vital. Schools should ensure that HVAC settings are maximizing ventilation, allowing for fresh air to circulate into the school and improving air filtration. Weather permitting, teachers and schools should also consider outdoor activities and classes when possible. This K through 12 school guidance will be posted at our coronavirus.ohio.gov site no later than tomorrow. These recommendations will allow school districts to develop plans for safe in-person learning for their students this year. Today, I'm joined by 2 doctors who will help answer questions about preparing children to go back to school this year. First, I'm joined by Dr. Patty Manning Courtney, Chief of Staff and Professor of Pediatrics at Cincinnati Children's Hospital. Dr. Manning Courtney, thank you for joining me today. We've seen over the course of the pandemic that masking can really help prevent the spread of COVID-19, particularly when layered with some of the other prevention strategies I outlined. Nevertheless, many students were probably looking forward to a new school year without masks. Why are masks still important for our unvaccinated students? And conversely, what are the risks of them starting this school year without a mask?
Thanks, Dr. Vanderhoff. It's good to be back talking about this important topic. So masks are important for kids in schools for 3 reasons. The first reason is that masks are very effective, as you said, and we learned last year wonderfully that schools and kids could do this well. It was the most pleasant surprise last year when school started and kids who were in person were able to comply with mask recommendations, and schools did many of the things that you stated, and we rarely saw significant school outbreaks, which was fantastic. The second reason is that masks will not only keep kids healthy, kids who can't be vaccinated and therefore at risk, but it will keep the people in their lives who might not be able to be vaccinated or who've chosen not to be vaccinated or for who the vaccine is not efficacious. It will keep them healthy as well, because those children won't be a vehicle for COVID to those individuals in their lives. And third, and so importantly, is that masks will keep our teachers healthy. There may be teachers also who either are immunocompromised or for other reasons, the vaccine's not been efficacious or they've chosen not to vaccinate. And we want them to be healthy. They are the backbone of our schools. And I've been so grateful to teachers in this past year for being as flexible as they've been. The risks, of course, without masks is that we'll see outbreaks. We'll see kids who need to be quarantined. We'll see kids who get sick. We'll see teachers who get sick. And I personally, I don't want to see that first child get COVID that could have been prevented by somebody being vaccinated in their life or them wearing a mask, and then have that child have a negative outcome. That would be so unfortunate at this time, a year later in this pandemic, when we've got so many tools to keep that from happening. I also want kids to go to school in person. I think it is critically important. One of my patients last week actually said, Dr. Manning, I think we need to go to school in the real world. And he meant in person, and I agree. And I believe that if we don't follow these mask recommendations for kids in school, we'll place that at risk for many kids.
Thank you very much. Children who've been home for the summer or spending a lot of time out of doors may be out of the habit of masking. What are some of the ways that parents can help prepare their children for wearing masks in schools?
So I'm fortunate in my career to be able to talk to families a lot about how they prepare children for different aspects of school. And certainly wearing masks would be one of those aspects. The first, of course, is that parents and caregivers can just talk to their kids about it calmly and confidently. Oh, we're going to have to do this again. Not a big deal. You did it last year. And again, I've said many times, kids have impressed me so much with their flexibility and their ability to wear masks and not make a big deal about it. There's a strategy we use in my field called social stories, where we write little stories for kids to prepare them for something that might be different. And they're simple little stories about school's going to start. We're going to keep wearing masks and it's going to be okay. And I think that's another strategy that can be employed.
While our schools did in fact return to in-person learning in the spring, some families may have continued virtual learning through the end of that academic year. What advice do you have for families of students who were virtual all through last year and may be anxious or nervous about having their children return to the classroom?
We're seeing this type of anxiety, not just with school, but anybody who might be returning to work after having been virtual for a long time. And I think the first thing is to remind those families and those students is that schools did this really well last year. We learned how to keep people safe in school. We learned that everything you said, masking, distancing, hygiene, ventilation, those things work. And our schools have a whole year of practice in doing that. So I trust our schools and our teachers to continue that good work and to keep our students safe. And I would impress that upon parents and students. I would also, again, I'd use social stories and storytelling to tell kids, it's going to be good. You're going to go back and it's going to be okay. Our kids look at us as the adults in their lives. If we're calm and confident, they can be calm and confident.
Thank you so much. Next, I'm joined by Dr. Shefali Mahesh, the Associate Chair of Pediatrics and Director of Pediatric Nephrology and Dialysis at Akron Children's Hospital. Thank you so much for joining me this morning. Dr. Mahesh, we know that in-person learning is beneficial to the physical and mental health of children in Ohio. Can you tell me why it's important for children to return to in-person learning this fall?
Absolutely, Dr. Vanderhoff. Thank you again for the opportunity to be here today. I think in-person learning is so important, and as you very eloquently articulated before, our kids go to school to learn and to get smarter in what we call our intelligence quotient, but also there is the emotional and social development, and so the emotional and social quotient that we need to work on. When it comes to learning, one of the things you're taught as a pediatrician is you've got to meet the child where they are. So when we talk to children, the skills they teach us is get down to the level of the child, meet them at eye level, sit next to them, put a comforting arm if they're not understanding something or struggling with something. Those things are very difficult to do through a computer screen. As a pediatrician, I look for nonverbal cues from my patients to say, they may not openly say to me, I don't like to take this medicine, or I don't understand this math problem, but I can tell by their body language that they're struggling. And in sitting down with them and saying to them, well, let's try this a different way. Those are some of the things that happen in in-person learning that we're not getting through a computer screen. And the same thing from a teacher's perspective. Our teachers are trained to find new ways where they can have children feel or touch things to maybe understand things a little better. Again, those are the skills that we're losing out when we're doing learning virtually. When we talk about other organized activities like sports and things like that, those are, again, things that children can have an opportunity to participate in if they go to in-person school. It allows for them to have a structure, not only for activity, but also for structured meals, for instance. We have noted that children have had an increase in obesity in this past year and a half, and the age group that has had the most increase in obesity is the 5 to 9-year-olds, because those are the children that, if they're home and not in a structured environment, cannot necessarily time themselves to eat or exercise, which in young kids, we like to call it playtime. So those are the other advantages that in-person learning can provide. The third challenge, I think, is the availability of access to the broadband internet, computers. We are aware that in the last year, 1 in 5 teenagers had to complete their homework on a smartphone. I can't even imagine how challenging that could be and what that does for their grades. And all of this can impact the confidence of our young children whose primary job is to learn and to grow. And so mostly I think that in-person learning and schools provide a safe, supervised environment for children to grow and thrive. And that's where the importance of going back to school in person is.
Thank you very much. We've certainly seen that children can become very sick or even be hospitalized with COVID-19. What would you say to parents who are still hesitant to vaccinate their children or encourage their children to mask as we move forward into this school year?
Absolutely. So, I think a year ago, we referred to the COVID-19 as a pandemic. I've started to rephrase that for my patients and families and started calling the COVID-19 now a vaccine preventable disease. And to me, that's very powerful because we've seen the impact that vaccinations have had in preventing so many long-term problems from measles and the polio and things like that. So I've started to hopefully talk with my patients and their parents about that to say, we have a tool, let's use it. In terms of masking, the example I like to use is of a wound or a cut. When we get a cut or a wound, we try to cover that up with a Band-Aid or a dressing. And we do that for 2 reasons. We want to keep it clean so that it heals quickly, but it also prevents us from picking at that wound or that cut. And that allows the wound to heal faster. And that's the way I look at masks. So masks protect us, but also allows transmission to be interrupted to the point that this will all be behind us, hopefully sooner than we can imagine it to be. So, I want to try to hopefully, encourage people to think about both vaccinations and masks in a little bit of a different manner. And then, as you rightfully pointed out, we've seen a lot of severe illness in kids, particularly with the multi-system inflammatory syndrome of children, where unfortunately, I've personally taken care of children that have been on a heart-lung machine or on dialysis. And it's heartbreaking to see that and to know that we could have prevented that. So I would encourage folks to reconsider, have another discussion with your healthcare provider or a trusted individual who has a trusted knowledge base to discuss this with you.
Thank you. We've talked about, I certainly referenced how it can take 5 weeks to be fully vaccinated for our vaccine eligible youth, those 12 and up. And while we're speaking primarily about COVID-19 today, well visits, physicals, other immunizations are an important part of the back to school effort. What general steps can families be thinking about as we approach this school year and they're thinking about the health of their child?
Yeah, so you absolutely correctly pointed out that there's a lot of things that we do in a regular school year to get ready to go back to school, which includes, getting our uniforms or our clothes ready, back to school shopping for supplies, but also the medical aspects of getting our annual school physicals and sports physicals for children that are wanting to participate in some sort of organized activity. There are children that have fallen off the radar a little bit because of the COVID-19 pandemic and haven't been able to get their physicals in. So August is right around the corner. It's a good time to rethink that. rethink some of the immunizations. I will tell you my personal experience. My daughter turned 12 in June, and she was the one to remind me that she needed to get her COVID-19 vaccine on her 12th birthday. And I even said to her, I said, do you want to wait a day? And she said, no, we're going to do it on my birthday so I can be ready to go back to school. So I've been impressed not only, by our patients, but my own children, where they've shared and the impact that going back to school has had on them, and the energy that they have to go back to school has been infectious for me.
Thank you so much. Well, in summary, our guidance strongly recommends COVID-19 vaccines for staff, teachers, and eligible students. We also strongly recommend that everyone in schools who is unvaccinated, students, teachers, staff, volunteers, coaches, wear masks indoors and outdoors when maintaining proper distance simply isn't possible. Masks continue to be very effective in preventing the spread of COVID-19 and will help students return to safe in-person learning this fall. Schools should also continue to layer the prevention measures that proved so effective last year, improving ventilation, maximizing distance between people, sanitizing and cleaning, and encouraging good hand hygiene are all important aspects of preventing the spread of COVID-19. As we approach the new school year, anyone who is not yet vaccinated and has questions about our COVID-19 vaccines should talk to their doctor or pharmacist or other trusted healthcare provider. Getting the facts from a trusted medical professional will help them to make a decision about their health and safety. Importantly, in issuing these recommendations, the Ohio Department of Health is relying on current epidemiologic information, regulatory requirements, and law, even as we anticipate full FDA approval of vaccines, hopefully in the near future. ODH will continue to actively monitor these factors and will update our guidance as this situation continues to evolve. Alicia, I think we can now open it up for questions.
Thank you, Dr. Vanderhoff. Our first question comes from Dan DeRose with WOIO.
Good morning, Dr. Vanderhoff. Thanks for making time for us on this important topic. Legislation that was recently passed has really tied the Ohio Department of Health's hands in passing mandates. It's very easy for you to say these are merely guidances that we would like to see the schools follow. Are you frustrated by that? And if it wasn't in place, would you make it mandatory for students to wear masks, especially those that are unvaccinated? Or do you feel like your hands are tied because of the new legislation?
Well, thank you for the question. I think that what we're able to speak to is the situation on the ground as it is right now. And I'm not going to speculate about how, if the, what would our guidance look like if the epidemiology were different or the rules and regulations were different. Essentially, what we are saying is there are really two ways to protect yourself and others from COVID-19. Vaccination is the best way, but if you choose not to or cannot be vaccinated, masking with layered safety measures is also a very good way to protect yourself and others.
Thank you, Dr. Vanderhoff. Our next question comes from Laura Hancock from Cleveland.com.
Hi, Dr. Vanderhoff. I have a question about hospitalizations, not just for kids, but for everyone. We are wondering, our readers have asked us, what percentage of people who are going into the hospital are people who have not been vaccinated versus those who have been? Thank you.
Yes, thank you very much. What I can share is the information that comes to us as part of the public reporting of our breakthroughs. So we get information about breakthroughs for hospitalizations and breakthroughs for deaths. So that means people who were fully vaccinated and yet still have to be hospitalized. And as we look at those numbers, they're very, very low. Offline, we can get you the latest total number, but I can tell you it adds up to being less than a fraction of a percent. So that doesn't really seem to, either in Ohio or nationally, to be a major concern or driver of what is going on right now. Really, if we look nationally and even internationally, the issue is this is fast becoming a pandemic of the unvaccinated. This is fast becoming a very dangerous and worrisome situation for people who are going without the protection of a vaccine, or in the situation of our young people who can't be vaccinated, not masking when they are gathered together, such as in school. Let me turn to my colleagues as well and see, doctors, would you add anything to that answer?
You know, I would just add that 100% of kids hospitalized under age 12 are not vaccinated. And we have children hospitalized with COVID. So it just goes back to that point we made earlier, that there's a critical group of our population, kids under age 12, who can't be protected, who can't access that tool. And so they really depend on the rest of us to access that tool. And I don't want to see the day where somebody under age 12 who can't be vaccinated was infected because someone in their life chose not to be vaccinated or chose not to wear a mask. That would be a sad day.
All right, thank you, doctors. Our next question comes from Jim Province with the Blade.
Good morning. Pfizer has indicated that a booster shot may be needed for at least some patients this fall. Are we taking that into consideration with the schools this fall? Is there a chance that we're going to have to do another round of vaccination of school employees?
Yeah, that is a very, very good question. And, you know, doctors have been concerned about whether 2 shots would be enough for people for a while, and have been closely monitoring the information that's coming to us from vaccine trials and other sources. The good news is that for the vast majority of people who are vaccinated, it certainly continues to appear that our vaccines are not only effective, they're effective against the Delta variant and appear to have real durability. They seem to be providing lasting protection. You may have seen that at its recent meeting, the CDC's Advisory Committee on Immunization Practices reviewed some of the emerging research that relates specifically to people with weakened immune systems. And specifically here, they were referring to transplant patients and cancer survivors, people living with HIV. And they offered preliminary support for offering a booster to that population, but frankly referred the question to the FDA Advisory Committee for further guidance. And the reason for that is that research is still very early, very preliminary. And I think that we are well advised to let the science guide us through that. You may have also seen some recent reports in which people are speculating, well, would there be benefit to vaccinating our older population with a booster? And again, the science is still in development there. Current indications are that people are very well covered. And there is nothing that I have seen that points toward our K through 12 students at all being likely to require a booster as we head into the fall school year. But I'm fortunate to be joined by 2 pediatricians. And so I'm going to turn to my colleagues and give each of them an opportunity to comment on.
I'm not sure I have much to add. Oh, go ahead.
Dr. Mahesh, would you start?
Sure. I was going to say, I agree with everything that was just said. You know, we haven't seen any reason, at least at this point in time, to require a booster in our clinical experience now. of course, as time goes on and the winter months come around and it gets colder, things might change a little bit. So we'll be vigilant for that.
And Dr. Manning.
Yeah, I would only add that we're watching closely, and we're on the front line of some of these vaccine trials, collecting data around the length of protection from our current vaccines. But like everything with COVID, it's going to be a watch and learn experience.
Thank you, doctors. Our next question is from Todd Dykes with WLWT.
Hi, everyone, and thanks for doing this. Dr. Manning, I'll ask you a fairly greater Cincinnati-centric question, or at least a couple. You mentioned a second ago that 100% of COVID patients at Children's in Cincinnati under 12 not vaxxed. I'm sorry, obviously there are vaccines available. Just very quickly, do you know that is that less than 25 patients, more than? What's the general number? Do you have any idea?
Our current numbers of hospitalized patients are very low. We're very fortunate. They've been very low for the past several weeks. They're ticking up a little bit. And I'm not prepared to share exact numbers, but they're very low. They're much lower than 25, fortunately.
That's good news. And then just let me ask you quickly, schools obviously are formulating plans, trying to figure this out. Children's has been such a big player in this region to try to give advice and input. Is that continuing? Are you in contact with a number of local schools? I know CPS, Cincinnati Public, is, they're going to discuss masks at the next board meeting. Just what's your sense of the lay of the land here? Because there are parents in different districts going, I don't know what we're going to do. And hopefully Children's is talking to my district and my leaders are, but maybe they're not. And what's your sense of the lay of the land out here?
So like many children's hospitals, I'm sure, including Akron and partners around the state, we've been meeting with school superintendents since the pandemic started. We have regular town halls. We had one a few weeks ago. I think we have another one scheduled the second or third week in August, and we provide guidance and direction, recommendations regarding these practices. So I feel like we've been in good touch. I know within each district, there's a lot, you're right, there are a lot of conversations and back and forth communication around what's going to happen, but we'll continue our role as an advisor to school districts.
Thank you.
Our next question comes from Noah Blundo with Hannah News.
Good morning. Thank you. Last year, there was a lot of discussion about how the pandemic was affecting kind of routine vaccination and healthcare uptake among K-12 children. How does that stand now? Do you have any concern about a mumps outbreak or things like that based on how things stand now? Thank you.
Well, thank you for that really timely question. One of the things that we've seen nationally is that routine vaccination did trail off during the recent months, the last year. And that's been of concern to us, both in public health and in medical care in general. And that's why it's very, very important for parents who are thinking about the new school year to be thinking about vaccines comprehensively. They don't want to enter the new school year having accidentally allowed many of the vaccines that are so important for protecting our children to have lapsed. And the good news is that while there was some uncertainty very early in vaccine release, we now have clear guidance that it is acceptable to offer the COVID-19 vaccine along with some of our other important pediatric vaccines. So that's very important because it eliminates the concern about having to make judgments about, wow, which one is going to be the most important for my child. They're all important. And we now have guidance which facilitates that. But again, let me begin with Dr. Manning, Courtney, and then I'll go to Dr. Mahesh so that they, as pediatricians, can speak further to this important issue that they're very familiar with.
So I don't have exact data at my fingertips, but I know for quite some time we saw a pretty big decline in our routine vaccination rates. And I believe we're still playing catch up. And that places us all at risk. It places our kids at risk. We certainly saw in the past several years as measles vaccine came under some attack because of its association with other conditions, including autism, we saw measles outbreaks. And so to Dr. Vanderhoff's point, parents have a lot on their minds all the time, but to get their kids caught up, to see their pediatricians, and make sure that all their healthcare needs are being met. And I just say, as on a related note, I'm sure Dr. Mahesh is seeing this too. We're seeing quite an uptick in routine respiratory viruses in general in kids, probably a rebound effect from all the protection we had from masking and distancing in the past year. And then we didn't see those things. Now we're seeing them. So more people are visiting their pediatricians for routine care of those types of illnesses. It's a good time to talk about catching up on other types of care.
Thank you. Dr. Mahesh?
Absolutely, yes. I agree with Dr. Patty Manning. We have seen an increase in RSV. I'm sure we're all noticing that across the country, not only in children, but even in adults getting infected with RSV. One of the things that we've done to try to counteract this backlog, if you will, is we've tried to improve access to routine vaccinations for children that show up at our doors for other things. So if they're here for a tonsillectomy and adenoidectomy, we'll say to them, and while they're leaving, we noticed that you've missed your vaccination for Tdap, and we can give it to you on discharge. And sometimes it's just about access, because it's yet another appointment for families to go back into the pediatrician's office. So I think it's incumbent upon us to try to improve that access so that we can allow these children to catch up. And then again, I think the epidemiology is again unpredictable when it comes to the flu season. We had a really, good flu season in the sense that we hardly saw any influenza. That could be very different this year. We know the influenza virus mutates too. So I think we have to be very vigilant going forward. Not only do we not want children to lose out school days because of COVID, but also RSV and influenza and the other respiratory viruses that we could potentially see in the coming season.
Thank you, Dr. Mahesh. Our next question is from Chelsea Sick with WKEF.
Hi there, thanks for taking my question. So without mask mandates in place, is this masking enforcement really the responsibility of the parent? And do you have any tips for school districts and teachers to help encourage students who aren't vaccinated to wear their masks? This obviously might be a little difficult for students to see some of their friends wearing masks and others not wearing it at all, which is a little different than last year.
Well, thank you. Yes, very, very good question. One that I'm sure many parents are thinking about now as they are looking ahead to the school year. The first thing I'd remind everyone is that masks still represent a very good way of protecting ourselves if we're unvaccinated and protecting the other people that we care about. And my colleagues, I think, spoke to that in our earlier comments. And it's a very, very important consideration. Each and every one of us, of course, lives in the context of other relationships. We have, other members of our family, other friends, people we may work with, who the last thing in the world we would want to do is get them sick if we could prevent it. We're saying vaccine's probably your best way, but followed by masking with these layered measures. There's another consideration though. And I know that many of our students really don't want the kinds of disruptions to their academic and sports and arts and music seasons this year that they experienced last year. And if individuals fail to avail themselves of one of the two ways of protecting themselves and others from COVID-19, vaccination or masking with these layered prevention measures, there's a very real risk that COVID-19 will disrupt your school year, even if you don't get sick, because you'll have an exposure that means you have to quarantine. So I think there are lots of good reasons for everyone to take our guidance very, very seriously and apply it. Let me start with Dr. Mahesh, and then I'll go to Dr. Manning. Courtney, would you add anything or have any additional observations in this regard?
I think children are very malleable and much more adaptable than us adults. Sometimes I think it's how you present it to them. Oftentimes, if we're able to discuss it at their level, like I said before, they're often able to understand that they would be able to attend birthday parties or have small gatherings or have a few of the activities that, that they weren't able to have last year had they not masked. So I think it's, again, about meeting them where they are and explaining it to them at that level is what is going to make it easier for parents to convince their children to mask.
I would just add, Dr. Mahesh made a great point. Speak to kids at their level. We sometimes overspeak to kids and give very long, lengthy rationales. A lot of kids don't need that. They just need to hear, this is the right thing to do right now for you, for your mom and dad, for your teachers, for your friends, for your grandparents. I think it's also important to remember that parents are often having to enforce things or enforce things in their kids that they hear from their kids, but so-and-so isn't doing it. And, you might be surprised as a parent to learn there are more families that are requiring their kids to mask, and make sure you connect to those families so that you can create maybe a little bonding or support group, because it's probably I think that those families will be in the majority, the families that want to keep their kids and their family members safe, and resist the urge to hear your child say nobody else is doing it, because there's a good likelihood that there are other people doing that.
Thank you. Our next question is from Jim Otte with WHIO TV.
Hey, just to be clear, you were saying that you are making a recommendation. This is not a mandate to school districts around the state. If in fact that is the case, could you confirm that? Secondly, would you have the legal ability under current or pending law to make a mandatory rule? And third, to confirm that this leaves it up to local school boards to decide what they want to do.
Well, thank you. We're making two very, very strong recommendations for people that reflect the best information that's available from existing science and the epidemiology. But we are mindful of some of the regulations and the like that are at play here in Ohio. Our strong recommendations are vaccination, if you are eligible, as our preferred option. Our second strong recommendation is if you're not vaccinated, your best protection right now is masking with these layered safety measures. Now, in terms of what schools can and should do with that, we recognize that every school, every parent is looking at COVID-19 through a slightly different lens. I can imagine that there will be school districts that are looking at their situation and may have a different context in terms of the rate of COVID-19 infection in their community compared to others. I think that the recommendations that we're giving are pretty clear, but offer the flexibility because they are recommendations to the local communities to take this guidance and apply it as best they can where they are. For example, I think it is fairly clear what our recommendations would be for most third grade classrooms. They're not eligible for vaccination. Therefore, our best recommendation would be for masking with strong application of some of the layered safety measures that worked so well for us in the previous school year.
Thank you, Dr. Vanderhoff. Our next question is from Alexis Mueller with ABC6.
Hi there. Thank you for taking our questions. As far as for COVID testing within schools, will there be any, tools or something that schools will get maybe for rapid testing to kind of help make sure that all of these schools are catching any of these cases kind of going forward, or just, any recommendations for schools when it does come to testing?
Yes, so we continue to have a very robust program of support for schools related to testing for COVID-19 and have continued to work very closely with them around access to COVID-19 testing. Because as you point out, testing will continue to be a very, very important mechanism, both from an individual and their healthcare perspective, but also epidemiologically as part of our effort to maintain public health and reduce spread. So yes, we've got a very robust program of testing that we continue to lean into.
Thank you. Our next question is from Maya Belay with Fox 8 Cleveland.
Hello. The majority of school districts in the Cleveland area are not requiring masks. What pushback, if any, did you receive from schools related to masking this school year?
Well, the best thing I can say about that is that in developing this, we reached out to many stakeholders, including people in education from across the state. And I'm not, at this stage in the game, aware of any specific pushback as it relates to the masking recommendations that we've developed. That doesn't mean we won't encounter that. But in the development of our recommendations, we worked very hard to engage many experts from around the state and nationally.
Thank you, Dr. Vanderhoff. Our next question comes from Courtney Francisco with WCPO Cincinnati.
Hello, thank you so much. I wanted to ask if your recommendation is for masks for everyone indoors or just unvaccinated, and any update on when children younger than 12 will be able to get vaccinated.
Okay, so in terms of the first question, our guidance recognizes that vaccines really work. And we thought that was very important. We wanted to clearly underline our confidence in the effectiveness and the power of the COVID-19 vaccines, and to recognize that current data continues to show that vaccinated individuals are very well protected against the development of a severe disease and very well protected from sharing this virus with other people. But we also recognized that there are people in our schools who have not yet chosen vaccination, who are not yet eligible for vaccination. And you referenced the group that is less than 12. And the best science available to us now tells us that they can remain very well protected as they were last school year by applying masking and the layered measures that worked so well for us in our schools last year, and hence our recommendations. In terms of what we're looking at for when the age group less than 12 becomes eligible, I can only tell you what I know about the information related to the trials, and it would appear that we will not see the trial information, the data from those clinical trials until midway into the fall semester of the academic year. I really don't know how quickly thereafter the vaccine approval will move through the regulatory processes. But again, I have two colleagues here. I don't know, colleagues, if you have heard anything more or differently about the clinical trials and approval of less than 12 years old.
Nothing to add there. That's we're all waiting for more information.
And just to be clear, you guys said that masks for everyone indoors, unvaccinated or not, or vaccinated, no mask indoors.
Yeah, so our recommendation is that those who are unvaccinated and indoors at school strongly recommend they be vaccinated. that would not prevent a school from making a decision based on other considerations, including potentially very low vaccination rates and high transmission in their community, from making a broader decision to have vaccination of all their students. But what we are saying is we can make two very strong recommendations. There are two best ways to protect yourself from this virus. One is vaccination, and it works. It's very effective. And we looked very carefully at not only the science, but the CDC's guidance, and are recognizing that our vaccinated students and staff are well protected and very unlikely to be sources of transmission during this stage of the pandemic. Secondly, we are recommending that those who are unvaccinated mask and apply the layered safety measures that worked so well for us last year.
Thank you, Dr. Vanderhoff. We have about time perhaps for just this one final question. There are a few questions that were lingering in the chat. If so, please message me those questions and we will respond to you in writing. Our final question is from Josh Rutenberg with Spectrum News.
Thank you, Dr. Vanderhoff, for taking this question. My question is how is it an effective health strategy to combat the spread of COVID-19 in schools if one school does not mandate masks and another one does? And isn't it true that a lack of a uniform policy could likely result in the further spread of the virus?
Well, I really can't speculate on what could happen, might happen. What I can say is the Ohio Department of Health has given this issue very serious consideration. The science is very clear. We are offering strong recommendations for the steps that we are confident will keep our children and our communities safe. Speculating about what could happen if people choose not to apply our recommendations is really beyond my role.